بسم الله الرحمن الرحيم. I am Ibrahim Allam, Assistant Lecturer of Obstetric and Gynecology at Tanta University Hospital. Today we will discuss MCQ and problem solving. Question number 1. The last menstrual period was 30 June. The expected date of delivery is approximately 23 March, 7 April, 28 March, 23 April, 7 March. Answer is B, 7 April. We detect the expected date of delivery according to Naegele's rule. By Naegele's rule, the answer is B, which is 7 April. Question number 2. The resting pulse in pregnancy is decreased by 20 beats per minute, decreased by 10 to 15 beats per minute, and changed, increased by 10 to 15 beats per minute, increased by 20 beats per minute. The answer is D. The resting pulse in pregnancy is increased by 10 to 15 beats per minute. Question number 3. In normal pregnancy, levels of all of the following hormone increase except total thyroxine, T4, parathyroid hormone in second and third trimester, free cortisol, prolactin, estradiol. The answer is B. Normal pregnancy, the level of the following hormone increase except parathyroid hormone in second and third trimester. Question number 4. Increase in blood volume in normal pregnancy is made up of plasma only, erythrocytes only, more plasma than erythroblast, more erythrocytes than plasma. Answer C. More plasma than erythroblast. Question number 5. Lower hemoglobin during normal pregnancy is a physiological finding. It is mainly due to low iron stored in all women, blood loss to placenta, increased plasma volume, increased cardiac output resulting in greater red cell destruction, decreased reticulocytosis. The answer is C. Increase plasma volume. As we know, plasma volume in pregnancy increase by 40 to 50%. Question number 6. In normal physiological changes in pregnancy, all of the following are increased except glomerular filtration rate, stroke volume, peripheral resistance, plasma volume, white blood cells. The answer is C. Peripheral resistance decrease during pregnancy and not increase. So the answer is C. Question number 7. Sure sign of pregnancy is amenorrhea, Heger's sign, nausea and vomiting, auscultation of fetal heart, abdominal distension. The answer is D. The sure sign of pregnancy is auscultation of fetal heart. Question number 8. If your patient is 8 weeks pregnant, which one of the following ultrasound measurement is most useful? Crown ramp length, biparietal diameter, femur length, placental site, abdominal circumference. The answer is A. Crown ramp length. Question number 9. The following statements are all true about vomiting in pregnancy except may be cured by admission to hospital, is commonest in third trimester, associated with multiple pregnancy, is associated with trophoblastic disease, is associated with urinary tract infection. The answer is B. Is commonest in third trimester. This is not true as vomiting in early pregnancy is common at first trimester. So the answer is B. Question number 10. First trimester pregnancy may be terminated by prostaglandin inhibitor, anti-progesterone, beta sympathomimetic agonist, synthetic estrogen, medroxyprogesterone? The answer is B, anti-progesterone. Question number 11. The following ultrasonic measurement may be used to confirm or establish gestational age: crown ramp length, nuchal pad thickening, amniotic fluid volume, yolk sac volume, by vesical profile. The answer is A, crown ramp length. Question number 12. Antenatal poking investigations include all of the following except complete blood count, blood sugar, hepatitis screening, thyroid function. The answer is E. We do all investigations, CBC, blood sugar, hepatitis screening for all women, but we do thyroid function in patients with thyroid disorder as hypo or hyperthyroidism. So the answer is E. Question number 13. An ultrasound in first trimester of pregnancy is done for placental localization, detection of fetal weight, assessment of amniotic fluid volume, detection of fetal breathing, dating of pregnancy. The answer is E, dating of pregnancy. During the first trimester, especially if the patient not know the first day of last menstrual period, we do ultrasound for dating of pregnancy and the detection of expected date of delivery. Okay. Question number 14. Serum progesterone value less than 5 nanogram per milli can exclude the diagnosis of viable pregnancy with certainty of 20%, 40%, 60%, 80%, 100%. The answer is E. If serum progesterone less than 5 nanogram per milli, we exclude pregnancy 100%. Question number 15. In normal pregnancy, the value of beta HCG double every 2 days, 4 days, 8 days, 10 days, 14 days. The answer is A. The value of beta HCG double every 48 hours or 2 days. So the answer is A. Question number 16. The beta HCG curve in maternal serum in a normal pregnancy peak at 6 weeks of pregnancy, 8 weeks of pregnancy, 10 weeks of pregnancy, 14 weeks of pregnancy, 18 weeks of pregnancy. The answer is C. The beta HCG curve reach the peak at 10 weeks of pregnancy, which is 50,000. Okay, so the answer is C. Question number 17. The following are considered normal symptoms of pregnancy except backache due to increased lumbar lordosis, lower abdominal pain and groin pain due to stretch of round ligament, visual disturbance, calf pain due to muscle spasm, increased vaginal discharge. The answer is C, visual disturbance. Question number 18. A woman in early pregnancy is worried because of several small raised nodule on areola of both breasts. There are no other findings. Your immediate management should be reassurance after thorough examination, needle aspiration of nodule, surgical removal of areola, mammography, radical mastectomy. The answer is A, reassurance after thorough examination. Question number 19. The source of progesterone that maintain the pregnancy during early first trimester: placenta, corpus luteum, corpus albicans, adrenal gland, endometrium. The answer is B, corpus luteum. Corpus luteum is the source of progesterone during the early first trimester. After that, the placenta will be the source. During normal pregnancy, weight gain anticipated, the average weight gain is approximately 5 to 10 kilogram, 10 to 15 kilogram, 15 to 20 kilogram, 20 to 30 kilogram, 30 to 40 kilogram. The answer is B, 10 to 15 kilogram. Question number 21. Regarding missed abortion, all of the following are correct except patient may present with loss of symptom of pregnancy. Bare vaginal bleeding may be one of presenting symptom. Immediate evacuation should be done once the diagnosis is made. DIC, disseminated intravascular coagulation, may occur as a sequel of missed abortion. Ultrasound should be done to confirm diagnosis. The answer is C. Immediate evacuation should be done once diagnosis is made. Question number 21. 14-week pregnant woman had abortion and she was told that is complete abortion. This is true regarding complete abortion. Uterus is usually bigger than date. Cervical os is open with tissue inside the cervix. Need to have evacuation of uterus. After complete abortion, there is minimal or no pain and minimal or no bleeding. Follow up with beta HCG for 1 year. The answer is D. After complete abortion, there is minimal or no pain and minimal or no bleeding. Question number 23. In patient with 3 consecutive spontaneous abortion, which is called habitual abortion, in second trimester, the most useful investigation is chromosomal analysis, hysterosalpingogram, endometrial biopsy, postcoital test, prolactin level. The answer is hysterosalpingogram. And by hysterosalpingogram, we see funneling, which is called loss of uterine worth. This is if the patient is not pregnant. If patient is pregnant and has history of 3 consecutive spontaneous abortion, we do ultrasound with comment on cervical dimension to detect if the patient has incompetent cervix or not. Okay, so the answer is B, hysterosalpingogram. Question number 24. Regarding cervical incompetence, all of the following are true except typically cause painful abortion, typically cause mid-trimester abortion, is treated by short-car suture, cervical circlage, which is best performed early in second trimester, may lead to premature rupture of membrane, can occur in patient with history of cone biopsy. The answer is A, typically cause painful abortion. As we know, cervical incompetence cause painless abortion. Question number 25. Causes of first trimester abortion: chromosomal abnormality, cervical incompetence, bicornuate uterus, gestational hypertension, preeclampsia. The answer is A, chromosomal abnormality. All other cause second trimester abortion, either cervical incompetence, bicornuate uterus, gestational hypertension, preeclampsia. So the causes of first trimester abortion is A, chromosomal abnormality. Question number 26. Management of patient with threatened abortion include all of the following except ultrasound, physical examination, CBC, delayed menstrual history, dilatation, and curettage. The answer is E, dilatation and curettage. Question number 27. 25 years old prime gravida with 8 weeks threatened abortion, ultrasound would most likely reveal second endometrium with no gestational sac, fetal heart motion in adnexia, empty gestational sac, collapsed gestational sac, and intact gestational sac with fetal pool. يبقى the answer is E, intact gestational sac with fetal pool. Question number 28. Regarding incomplete abortion, all are true except there is history of tissue passed per vagina, cervix is open on vaginal examination, ultrasound show retained product of conception, Ultrasound show intact gestational sac, non-viable fetus. Management include evacuation. The answer is D. Ultrasound show intact gestational sac, non-viable fetus. This is for missed abortion, not for incomplete abortion. So the answer is D. Question number 29. Most common cause of first trimester abortion: chromosomal abnormality, syphilis, Rh isoimmunization, cervical incompetence, bivercate uterus or bicornate uterus. The answer is A. Chromosomal abnormality. Incompetent cervix is a cause for early pregnancy loss, is diagnosed by history, is a cause for fetal congenital abnormality, is not encountered with uterine anomaly, can be treated with tocolytic. The answer is B. Is diagnosed by history. Patient came with painless dilatation and investment of cervix, then sudden rupture of membrane, then abortion. So the answer is B. Question number 31 of proposed etiology for recurrent pregnancy wastage or pregnancy loss. The least likely is maternal trauma, maternal balanced translocation, paternal balanced translocation, luteal phase deficiency, autoimmune disease. The answer is A. Maternal trauma. Question number 32. The most common etiology for spontaneous abortion of a recognized first trimester gestation: chromosomal anomaly in 50 to 60% of gestation, chromosomal anomaly in 20 to 30% of gestation, maternal hypothyroidism, maternal diabetes, progesterone deficiency. The answer is A. Chromosomal anomaly in 50 to 60% of gestation. Question number 33. In threatened abortion, which one of the following item is true? Cervix is open, evacuation is the best treatment, all patients should be admitted, in the majority of cases pregnancy will continue without any complication, doesn't necessitate giving anti-D for Rh negative mother. The answer is D. In the majority of cases pregnancy will continue without any complication. Question number 34. In case of threatened abortion, fetal heart is present, cervix is dilated, there is history of passing tissue per vagina, patient need immediate evacuation, no need to give anti-D for Rh negative mother. يبقى the answer is A. Fetal heart is present. Question number 35. Missed abortion may cause one of the following complications: bone marrow depression, rupture uterus, high positive serum beta HCG, skin allergy, coagulopathy. The answer is E. Coagulopathy, which is DIC, disseminated intravascular coagulopathy. Question number 36. Management of patient with threatened abortion include all of the following except ultrasound, physical examination, CBC, detailed menstrual history, immediate dilatation, and curettage. The answer is E. Immediate dilatation and curettage. Question number 37. During first and second trimester of pregnancy, the most common pathologic cause of vaginal bleeding is hydatiform mole, abruptio placenta, ectopic pregnancy, abortion, uterine rupture. The answer is D. Abortion. Question number 38. Which of the following items may be associated with mid-trimester abortion? Recurrent pelvic infection, maternal smoking, uterine anomaly, sickle cell disease, hyperemesis gravidarum. The answer is C. Uterine anomaly, especially septum or bicornate uterus. Question number 39. Bleeding in early pregnancy could be caused by all of the following except ectopic pregnancy, trophoblastic disease, carcinoma of ovary, invasive carcinoma of cervix, threatened abortion. The answer is C. Carcinoma of the ovary. Which of the following is correct in treatment of case of threatened abortion. Bed rest, oral stilbestrol, curettage, urgent admission to hospital. The answer is A. Bed rest. Question number 41. 26 years old married woman whose last menstrual period was 2.5 months ago developed bleeding, uterine cramp, and passed some tissue per vagina. 2 hours later, she began to bleed heavily. Question number 1. The most likely diagnosis is twin pregnancy, threatened abortion, inevitable abortion, premature labor or preterm labor, incomplete abortion. The answer is E. Incomplete abortion. As by history, patient develop bleeding and pass some tissue per vagina. Of the option listed, the bleeding is most likely due to retained product of conception, ruptured uterus, a systemic coagulopathy, vaginal laceration. The answer is A. Retained product of conception. The indicated procedure is hysterectomy, vaginal packing, compression of hemorrhoids, intravenous fibrinogen, uterine curettage. The answer is E. Uterine curettage.